Post-surgery, you will be non-weight bearing and precautions of no range of motion in the shoulder joint. However, you will be able to move at the finger, wrist, hand, and elbow joints. Anytime the sling is not being worn, the arm must be supported. The shoulder must be relaxed and the elbow at 90 degrees. Have a stack of pillows, blankets, towels, armrests, or anything else that will support the shoulder joint. Then, take your hand and grab onto the front of your shirt. This will help support the shoulder joint. Lean away from the surgical side and slip the sling under your arm on top of your supportive pillows, blankets, armrests. The elbow should be as far back in the sling as possible. Make sure the clasp on the bolster is in front of your body. If you do not see it, you have your bolster on backwards and you will need to fix prior to going to the next step. You may now release the grasp of your shirt and place your hand comfortably in the sling. The first strap that must be buckled is the shoulder strap. It is the first strap buckled and the last strap unbuckled. This is very important and will give the most support to unload the shoulder joint. There are two buckles with this strap. The front buckle will lock to the front clasp and the back buckle will lock to the clasp behind the sling. It does not matter what buckle you do first, as long as both are locked before you remove your supportive pillows, blankets, armrest. You will hear an audible click noise when they are locked. Next, you may now remove your supportive blankets, pillows, towel. Now, take the strap that goes around the back of your waist. You may throw it behind your back with your non-surgical arm. From there, you will be able to reach back with your non-surgical arm and grab the strap. Make sure the strap is as straight as possible, having no twists behind your back. It is important to have a shirt or some type of fabric between the strap and your skin. The strap is then going to be buckled into the clasp located on your bolster. It works the same as a seat buckle. Once it is locked, you will again hear an audible click, knowing it is locked in place. Next, you will take the forearm Velcro strap that is connected to your sling. This is located on the inside portion. This will come over top of the opening of your sling and Velcro to the outside portion furthest from your body. This will prevent any excess movement of the arm inside your sling while engaging in any activity. It will hold it in place as much as possible. Lastly, you will Velcro the thumb strap. If your arm is bigger, this will keep your hand in place. If you have a smaller arm and your hand is not sticking out of your sling, it won't provide much support. However, you want to Velcro it anyway. Once all straps, clasps, and buckles are in place, you may stand up. After standing up, if you need to make any of the straps tighter for maximal support, please do so. Remove both the forearm and thumb Velcro straps to get them out of your way when beginning. Next, you will undo the bolster clasp connected to the waist strap. This will be very similar to a seat belt buckle. Take the strap with your non-surgical arm and get it out of the way. After this, make sure you place your support back under your arm while it is in the sling and the shoulder strap is still locked. Lean away from the surgical side to make room for your support. When that is in place, it is safe to undo the shoulder strap. You will notice some slack in the shoulder strap prior to undoing the clasps. This means that your shoulder is being supported by your pillows, blankets, towels. It does not matter which clasp you undo first. The front clasp and the back clasp will both need to be unlocked prior to going to the next step. To do so, push directly in the center of the button with your non-surgical arm and push up on the clasp simultaneously. You will hear a click and the buckle will become undone. Use your non-surgical arm to get the strap out of your way. You will then lift your arm up by moving at the elbow joint, not your shoulder joint, and grab a hold of your shirt with the surgical arm. This will give self-support prior to removing the sling from under your arm. You will then lean away from your surgical side and remove the sling completely with your non-surgical arm. Make sure your support system is in place. Once it is, you may relax your arm on top of it. This way your shoulder is still 100% supported, not bearing any weight through the joint and following all precautions. You may now remove your hand from the front of your shirt.